Where people live together in communities such as care homes, there is always the opportunity for infections to spread where eating and living accommodation are shared. Infections are a major cause of illness in care home residents, which may result in admissions to hospital. The Code of Practice in the Health and Social Care Act sets out 10 criteria that a care home is judged against to show they comply with the registration requirements for cleanliness and infection control. By following standards of best practice set out in this video, such illnesses and subsequent admissions to hospital can be avoided. Whilst there are a wide range of microorganisms found in healthcare settings, including viruses, fungi and bacteria, the majority of healthcare-associated infections are caused by bacteria that can be carried by healthy people without causing any harm. Most don't make us ill, but there are some that cause specific infections such as MRSA, Clostridium difficile, norovirus, salmonella, influenza, hepatitis B and scabies. The chain of infection is a way to describe how infections are spread between people. Microorganisms can live on or in the body, such as on the skin or in the gut, and are part of our normal body flora. They can also be found in the environment, on equipment, and in contaminated food and water. All microorganisms need to have a way to get into the body, and there are a variety of ways they achieve this. The environment becomes contaminated with microorganisms shed by the body, and poorly maintained or inadequately cleaned equipment can harbour microorganisms that then become a reservoir for infection. For infection to spread between people, organisms need to be excreted from the body. Norovirus, that causes winter vomiting outbreaks, is excreted in vomit or diarrhea and is highly contagious. To acquire the infection, you need to either breathe in the virus particles, eat food contaminated with the virus, or acquire it by touching people, equipment, or the environment that is contaminated with the virus. Whilst some microorganisms are spread on hands, others, such as viruses, are found in the saliva and sputum and are spread through coughing or sneezing in the droplets or aerosols that are produced. Hands can easily become contaminated with microorganisms, making the practice of effective hand hygiene the #1 way to reduce the spread of infections. Microorganisms are transmitted by aerosol, droplet, fecal oral, direct contact, person to person, indirect contact, food, water, inanimate objects, the environment, blood and body fluids, excluding sweat, insects and parasites. Finally, the chain of infection is complete when you consider who is susceptible and at risk of acquiring an infection. Things that affect your risk to acquire infection include age. The very old and the very young are most at risk. Immune status. Physical and psychological health. Hygiene. Underlying chronic medical conditions. Existing infection. Medical interventions, for example, urinary catheters. Medical treatments, for example, antibiotic therapy and chemotherapy. By breaking the links in the chain, you can help to prevent the spread of infection. This is achieved by following standard precautions of washing your hands, the hygienic preparation of food, and following high standards of cleanliness, wearing single-use disposable plastic aprons and gloves when required, making sure you are bare below the elbow, as long sleeves, watches and jewellery stop you from washing your hands effectively.